who attends the tumor boards: radiologists, pathologists, surgeons, medical oncologists, radiation oncologists, fellows and residents in training, oncology nurses, data managers, research nurses, palliative care team, reconstructive plastic surgeon. Other specialists may be invited according to the cases presented. Now, tumor boards in Arab countries, it's practiced in large academic and specialized hospitals. Variably, they treat variable numbers of patients depending on the country. Our impression and field knowledge was that most private hospitals, smaller hospitals, hospitals located outside of big cities, do not have tumor board meetings. So is that true? We don't know. This is the subject of our study. And just here I put down an example of a case that I just 2 weeks prior to this conference, a patient with a 7-centimeter tumor. She had an excisional biopsy. You know, if this surgeon has spoken to a radiologist or even to a pathologist, you could have told him easily, well, we can get the biopsy or FNA very easily without doing the excisional biopsy, which is a surgical procedure, then to proceed with further management. So we did a situation analysis, a pilot survey, to get to know the extent of the practice of regular tumor boards in Arab countries. We wanted to identify obstacles and make some recommendations for more tumor boards, more cooperation between specialists, hospitals, and also in different cities. We designed a questionnaire that we distributed at 4 hematology oncology conferences in March and April of this year. 2 meetings were held in Riyadh, 1 in Beirut, and a major meeting in Algiers. That was the Pan-Arab Cancer Congress in Algiers. The questionnaire was distributed to about 1,200 people. We had 319 returned. The answers, we downloaded them manually on a website, SurveyMonkey. I don't know if any of you heard of it, but it's a very nice and helpful website for surveys. And here are the results. Now, the first question, one of the third question actually was where do you practice? And in a capital city, 56% of people, and another big city, 35% of people. So what we have is that the vast majority of people really practice in big and capital cities. About 50% of those who responded said they practice in university teaching hospital. That's probably a sample bias, people attending the meeting. The number of breast cancer patients seen at your hospital per year, we had variable answers. That was important here. Who administers chemotherapy? Who treats, as a medical oncology, as we understand it? What we had, as you can see there, is that about 44% have more than 5 radiation oncologists who also administer chemotherapy. So really, radiation oncologists are very important to target. They really deliver most of the chemotherapy in a lot of places. Now, asking people if they have a fully operational pathology department, 3/4 said yes, but 1/4 said no. 25% and no fully operational pathology department. And where do they send their pathology? Either a nearby hospital, nearby private laboratory, 40%, which is important, private labs. Outside the country, 4%, others 6%. Now, do you have a general tumor board? Surprisingly, 72% said yes. We had thought it was less, but that's the answers we got. 27% did not have a tumor board only. Now, how often they hold the tumor board? Half of the people hold it weekly. The others bi-weekly or even monthly. And obviously, this is not enough. to discuss all the cases that they may be seeing. Who attends the tumor board? We have a variety, nice mix, all. Now, how many cases are presented? We asked that just to see they discuss interesting cases, problem cases, or routine cases. We had variable answers. Now, the level of discussion, some people say they have in-depth discussion about 50% of the cases of the people. 50% say they have focused management discussion. Now, the selection process, most people have no selection process. How do they decide which cases go on the tumor board discussion? Here is just, we asked questions on, do you discuss before the biopsy, after the biopsy, before radiation, after radiation, etc. We have a mix of answers. Our recommendations from the tumor board minuted. We had also here variable answers, but about in one third of the answers, the chairperson minutes the recommendations, and in 31% notes are made in patient's chart. These are important to carry on the decisions of the tumor board. Now, why do people attend your tumor board? As you can see, 60% of people said they come to present their cases to get a group opinion, so to get help in the management of their patients. Now, do you wish to have a tumor board if you do not have any? 28% said no, surprisingly, actually worrisome, troublesome, but 71% said yes, they wish to have a tumor board. Why do you not have a tumor board? And 46% of people said because of the lack of staff. That's very important, lack of staff and lack of specialists. And we asked people, if there is no tumor board, would you consider having a mini tumor board meeting, like just having a radiologist and a surgeon, pathologist and a surgeon, or just surgeon and the oncologist? Almost everybody wanted some form of meeting. And really the purpose of the question was just to also disseminate the idea that if you do not have a full team, you can have a small team that meets and discusses the cases. Now, we asked people, would you agree to make tumor boards mandatory for all physicians and hospitals that manage cancer? And interestingly, 94% of the people said yes. And I like that. I thought this would start my conclusions slide. Very important that people would agree to make it mandatory, full tumor board or even a mini tumor board. So in summary, the vast majority of people practice in capitals and major cities as per this pilot survey. Large numbers of radiation oncologists also act as medical oncologists. About 50% of doctors who answered say they do have tumor boards. About 50% hold it every 2 weeks or less. 82% have no selection process for presentation of cases. Lack of staff is the main reason for not having a tumor board. 25% of people have no pathology departments at their hospital. At least 25% hold mini tumor boards. 90% of people agree to have tumor boards mandatory for physicians and hospitals who take care of cancer patients. Now, is this feasible? As a comment, move the C down here. Could we link, that's something for discussion, could we link tumor board requirement for insurance reimbursement or even Ministry of Health payments, subsidizing hospitals? You have to put a condition that you have to have a tumor board if you want to be reimbursed for the care of cancer patients. And with this, I thank you much for your attention.